Hi, I'm Chaney, coming to you from Her Plan here in the studio of our mother organization, Susan B. Anthony Pro-Life America. It's such an honor to present to CCHF 2023 on comprehensive care for pregnant and parenting patients. Let's get started. So when we're talking about comprehensive care, we want to look at medical, social, and material needs. We want to see a woman holistically and care for her body, mind, and spirit. A little bit about me. I'm not a physician or a social worker, but I did work for an OBGYN on their non-clinical staff for 4 years. My expertise is really in the pro-life movement, but I've always had a heart for making sure that medicine is a part of that. I'm an ecumenical Christian and feel very much at home in the mixed and diverse CCHF family where so many denominations can come together. Today, we're going to take an accompaniment approach, walking in the shoes of women in need. Regardless of our politics, we are together in care, and we do care about helping pregnant and parenting women and families. We often use the phrase life affirming as it denotes that we care for mom and child, and we require providers who are listed on our Her Plan primary directory to be life affirming in the sense that they don't support or refer for abortion. I like this quote by the Equal Rights Institute, "I'm pro-life, but I'm not what you think." It's true that sometimes our stereotypes can get in the way of real conversations, and we really want to have a love them both, pro-grace, pro-love approach. Stand for Life has called it making abortion unnecessary. We want to be there for women regardless of their situation. So our objectives are with the recent changes in abortion law to really examine that women in the communities we serve will be affected, and Christian clinics are uniquely designed to care for needs of pregnant and parenting patients. And we'll discuss some in-house services that can combine the best of medical and social care and address women's health in life-affirming ways. So we're going to first talk about the increasing need for maternity care in a post-Dobbs world. We're going to talk a bit about comprehensive care and Her Plan. And then we're going to talk about unique medical services and screenings. So first, the increasing need for maternity care. There's going to be changing laws, and they continue to change. There's going to be remaining concerns about pregnant and parenting women and their needs, a projected need for how many more women we must care for now, an understanding of what women truly want, and the opportunity we have to serve them. So first, changing laws. You can find on sbaprolife.org/lifesaving-laws up-to-date information about which states have outlawed abortion. You can see 14 states here have a total or near abortion limit, and many others are considering such limits or have them dependent on legal action. You can see a sampling here of many states and what their abortion numbers were before the overturn of Roe versus Wade. And we can't exactly project that there will now be that many more women now in need of prenatal care and services, because of course there are going to be some women who now seek to avoid pregnancy proactively. And there is also a rise of chemical abortion and travel and telemed abortions. Initial data from the Society of Family Planning shows that abortion is decreasing in pro-life states, and it is increasing in pro-abortion states because of travel abortion, but it's not enough to offset the decrease. So there will now be women who are remaining pregnant and need care in states where abortion is illegal, and really all states. It's important to look at these numbers, which can be sobering, and to think about the mothers and babies and what we could do to help reach these women in moments of need. So the abortion industry has a strategy around the current state of the country. It does include abortion clinics and also what they're calling abortion referral centers, which can refer to other states, maybe across borders, that have abortion still. This is a map from Sidewalk Advocates for Life, and they're sort of showing the arrows for where women tend to travel now in an effort to seek an abortion. We really do want to have a pro-life response to these strategies with pregnancy help organizations, with online helplines, abortion pill reversal. We're going to talk more about that soon. But it's important to know that telemedicine abortion and mailed abortion pills, as well as travel for abortion and even mobile abortion units, do pose a remaining threat in a post-Roe world where we really need to be able to be there for women and families. So what do women really want? Women don't really want abortion. We found that over 60% of women, as reported in the Daily Signal from research from the Charlotte Lozier Institute, actually reported high levels of pressure from other sources that they didn't really want an abortion, but were forced to have one in some sense, or at least pressured into it. And those same women also reported negative mental health outcomes following that abortion. Let Them Live is a group providing financial assistance to women, and 73% of women have abortions due to financial burden, according to their research. So women really want a listening ear. When they're in a difficult or an unplanned pregnancy, regardless of the circumstance, be it financial, emotional, or relational, they want someone to be able to attune to their needs, to say things like, that sounds like it must be hard sleeping. It sounds like you're in a deep hole. I highly recommend considering taking Equipping Ministries Listening for Heaven's Sake course, because whether clinician or Christian or both, it's important to be able to truly have listening skills to attune to a woman's situation. The opportunity. Christian clinics offer a very needed alternative view of healthcare that is not always possible in the mainstream healthcare world. Firstly, there's the cost, and there's the affordability that sliding fee scales or fundraising allows in our context. Unfortunately, wait times are very problematic for women who are pregnant, particularly those with high-risk pregnancies or risk of miscarriage or other health conditions that have to wait a really long time to get in to see an OB. There's also miscarriage care that's often not as sensitive to the loss, or not as willing to work to prevent miscarriage. Sometimes mainstream OB care doesn't see spirituality as a part of health, or it's going to be more pro-choice and even perform a refer for prenatal diagnosis terminations. And we have an opportunity to be an alternative that is fully and comprehensively life-affirming, accommodating, having special slots for women who are abortion-minded or vulnerable in some way, to prevent miscarriage by testing progesterone, to have a holistic life-affirming approach, and to offer special services like perinatal hospice, even for difficult cases, which we'll talk more about in a bit. So comprehensive care, what is that? Women deserve this holistic approach, this total approach, medical, social, and material. What does that mean? How does she get that? Well, there's the aspect of accessibility. A service may exist, but if a woman is lacking in any one of these aspects of access, she's not going to actually be able to benefit from that service. So comprehensive care does require us to increase accessibility. So the resource has to exist, but then she has to have awareness of it. It has to be acceptable in her culture to use that resource. That resource has to accommodate her specific needs. It has to be affordable for her. There have to be appointments available at good available hours. There has to be a location, a clinical location in an area that's safe and easy to find. And services have to be accessible via transportation. She has to have some way of getting there if it's an in-person service. She has to actually show and then be accountable for any follow-up steps and additional referrals that are required. So there's a lot of aspects to access that we should be considering for our clientele. So first, an overview of pregnancy centers and pregnancy help organizations, which are an important part of a comprehensive approach. Pregnancy helper resource centers were formerly called crisis pregnancy centers. Typically now we don't use the word crisis and pregnancy together because the idea is the pregnancy itself is not a crisis, but she may be in a crisis in other aspects of her life and need support and resources like options counseling, parenting classes, and material resources. There are also medical pregnancy centers or clinics that provide services like an ultrasound or a pregnancy test or a urine STD test. There's also mobile ultrasound units, which can be thought of as medical pregnancy centers on wheels. And then there's expanded medical pregnancy centers or clinics that offer additional medical services of various kinds. There are also adoption agencies, which are considered pregnancy help organizations because adoption can be an alternative to abortion, which we'll discuss more later. There's also abortion recovery ministries. Sometimes those are offered in a pregnancy center. Other times they're independent or offered virtually in support groups or one-on-one. There's a great variety, and we'll talk about that more later as well. And finally, there are maternity homes. Maternity homes are a type of pregnancy help organization that does vary in terms of length of stay, in terms of whether they can accommodate other children that a woman might already have, whether they accept only pregnant women or women who've already had a child, and there's a great variety amongst them. So, comprehensive care. These are our HER plan categories and subcategories of care, and we want to assure you that you are a part of the life-affirming safety net. If you have a CCHF clinic, we really want you to consider being part of our directory, which you can sign up for at herplan.org. You can help pregnant and parenting women, even if you're not exclusively only for them. So it's important to know that there are many, many types of organizations here. I want you to be able to see all these categories and subcategories, from mentorship to health and well-being to financial assistance. There are ministries and organizations in your community that you could recommend to us, from transportation to basic needs, thrift stores, food banks, daycares, Celebrate recovery groups, professional counselors, disability Sunday school support. It's a full, large variety of care resources that can be there for pregnant and parenting women, even if they also serve other types of patients or clients. So the HER Plan directory can be found on directory.herplan.org. As of the time of this recording, we've published initial directories in 12 states, and you can filter through to find the best resource in the directory, and I highly recommend you go play with it. You can also contact us at info@herplan.org if you'd like to schedule a training or be sent our training videos. This is our trajectory of our active states. If you see yourself, even if you're not expected until August 2024, please go ahead and fill out the application. We'd love to have it on file. It is completely free to be part of our network. We just do a basic vetting process. So that's why we have an enrollment form, which can be found at the top of the page on herplan.org's homepage. So now I'm going to move a little bit to talking about unique medical services and screenings so that you can understand your contribution even more to a life-affirming approach for pregnant and parenting patients. So collaborating with PHCs, which is an abbreviation for Pregnancy Help Center, it's absolutely vital that medical professionals who are life-affirming have relationships with their local pregnancy centers. They depend on you to be able to offer any medical services at all. You might choose to serve as a medical director. You don't have to be an OBGYN. You could also choose to read ultrasounds, to be trained in reading limited OB ultrasounds, or maybe you have a radiologist who could do it. It doesn't have to be a radiologist. And also the medical director and the person reading the ultrasounds don't have to be the same person. So it can be a team effort here. You can actually also consider going on site to offer some form of expanded medical care. Maybe you're willing to offer early prenatal care at a discounted rate, or blood pregnancy testing, or a more advanced type of ultrasound. You can also accept referrals from pregnancy centers and work out arrangements to make that easier. You might want to take on clients that need prenatal care or even post-abortion medical care or pediatric care for children who are born to mothers who have visited pregnancy centers. I also wanted to point out some trending brands, which are hybrid models of medical practices and pregnancy centers. They live somewhere in between. Obria and Guiding Star and Thrive and Stanton and Morning Center prenatal clinics, they're all their own brands and they all have their own unique features, but I highly recommend checking them out if you're interested in this field of medicalization in the pro-life movement. There's also a consortium of pro-women's healthcare centers with specific standards you can look into, and also a network of pregnancy medical clinics. I want to talk for a bit about chemical abortion so that you really understand. I mentioned that it's a rising threat and part of the trends in this new post-jobs world. Mifepristone and misoprostol are both involved. It's a 2-drug regimen. So the mifepristone is actually working as a progesterone blocker, whereas the misoprostol, also called Cytotec, causes contractions and is actually what expels the baby. So a mom ends up delivering the baby often in the toilet at home. To learn more about the chemical abortion regimen and how it can be both medically and emotionally difficult for women, you can go to abortiondrugfacts.com. There's also a link here to the Heritage Foundation review about chemical abortion. The Charlotte Lozier Institute has done a lot of research on the risks of chemical abortion. You can see here that studies have found that chemical abortion is actually has 4 times the complication rate of surgical abortion. And there's also even a risk for future pregnancies if an Rh negative woman is not administered RhoGAM, if it's indicated at the time of her chemical abortion. There's also gestational age miscalculations that can easily happen, particularly if she's not seen in person for an evaluation. You can also miss an ectopic pregnancy because of that, which can put her life in danger. There's also bleeding risks and other medical complications. Maybe she needs emergency surgery, and if she's in a rural area, that's hard to even get there. And also, it's very easy for chemical abortion pills to fall into the hands of abusive partners or even traffickers, and to want to administer those pills, those drugs to women, even without her consent. So your clinical response to this could actually involve implementing abortion pill reversal, which I'm going to talk more about in a second. You could also consider offering post-abortion medical exams, as I mentioned. Advice in Aid actually has an interesting model where it doesn't actually require an ultrasound, but it does require a medical evaluation of a woman's vital signs with referral for emergency care if needed. And there's a spiritual and emotional aspect mixed into the medical. So they have a dual program for comprehensive healing, which I find very inspiring. I wanted to also send these links and include these because APLOG, the American Association of Pro-Life OBGYNs, has done a fantastic video series on the abortion pill reversal protocol, debunking the common myths. It's sort of an FAQ Mythbusters video series, and there's some other links on here that you might find very helpful as well. So I'm going to move now to talking about prenatal diagnosis. This is a very important aspect of caring for families who might not fit your stereotype of what an abortion-minded woman normally looks like, but who are often being told by their doctors to have an abortion in the case of any kind of fetal abnormality, even if it's not a life-limiting abnormality. It could be Down syndrome, could be a medical condition. And this new website, prenatalddiagnosis.org, has come out as an alternative. It's trauma-informed, it's parent-centered, it's scientific. It has information from excellent scholars, as well as personal stories and support organization. It also has ethics considerations. There's links to the National Catholic Bioethics Center. I'm not Catholic, but I'm so glad there is a bioethics center hotline available so that families can get 24/7 advice for difficult ethical situations to weigh in their considerations. And there's also a prenatal diagnosis hotline that will soon be hooked to this website. And when a family calls the prenatal diagnosis hotline, they'll actually get connected to what's called a parent care coordinator, which is essentially a free care coordinator or case manager for the duration of their pregnancy and a year after, so they can have the accompaniment through their experience. So there are 3 major types of prenatal diagnoses that prenatalddiagnosis.org covers. There's disability conditions such as Down syndrome or limb differences, and there's some featured support organizations like Ability Ministry, Joni and Friends, Key Ministry, Accepting the Gift, and Prenatal Partners for Life, as well as Hope Story for Down syndrome specific cases. There are also medical conditions, which could mean anything from needing a NICU stay to a newborn surgery to a therapy. There may or may not be lifelong medical complexities. It could be anything from a cleft lip and palate to a congenital heart defect surgery, could be a newborn surgery, could be an in utero surgery, like for spina bifida. There's some papers here from the Charlotte Lozier Institute about this, and some featured support organizations as well. Finally, there's perinatal hospice. So this is essentially a term for pregnancy and birth care after a life-limiting prenatal diagnosis, rather than terminating a pregnancy, which can actually cause pretty complex grief for the women because these were often wanted planned pregnancies. And if there's this approach of comfort and palliative care to accompany perinatal bereavement care, essentially the family is able to carry the pregnancy as far as possible to safely do so for mom. And then they're often able to meet their child alive, which can be extremely healing and precious for all the child to know, for it to be a chance to get to know their child and for the child to only know love in the course of their short life. So anencephaly or sometimes trisomy cases in hospitals that aren't equipped to care for them, and serious congenital heart defects can also be life-limiting. And there's some specific organizations like perinatalhospice.org, Verity's Village, Able Speaks, Alexandra's House. These are groups that are devoted to dealing with these difficult situations and to accompanying parents through this painful process. So I'm going to shift gears a little bit and talk about adoption and encourage you to be willing to talk about adoption in the course of your medical care and practices. So this is a handout from Lifeline Children's Services that compares parenting, adoption, and abortion, quite honestly, as they're seeking to give women more information. We want women to have fully informed consent to whatever she chooses. There's a great adoption toolkit that is now available as a collaboration between Lifeline and the American Association of Pro-Life OBGYNs. I highly recommend taking a look at this. There's even door hangers for the hospital, just like you would hang a special symbol if there was a stillbirth or a late miscarriage in the hospital. There are also amazing adoption symbols to really be sensitive to the fact that an adoptive family or a birth mother planning to place her child is giving birth in a certain room. There's also a great handout on life-affirming adoption language, which I've summarized here. It's very important to use good, kind language. The terms like gave up for adoption or put up for adoption are considered outdated because it seems as if the mom is just giving up on parenting, and you don't want to create the impression that the mom doesn't care about or love her child. Often it's a very selfless and very difficult decision to place for adoption, and she does love her child, and she has entrusted her baby and made an adoption plan. So typically made a plan or placed is preferred language. If she chooses to parent, that's a better phrase than keep the baby. And then also a pregnancy can be unplanned or unexpected, but not unwanted. It's not an illegitimate child, and a child was adopted, not is adopted. So it's just a part of their life, not their identity. It can be very difficult for women who are placing for adoption, and unfortunately, due to some unethical adoption practices in the past, women of all ages really do find a lot of solace in coming together with other birth mothers and sharing their experiences, good or bad. So these are a few resources, including a new support group called SEEN that can be excellent for really ministering to birth moms. So now we're going to shift to support after abortion, which is another important service to consider incorporating into your ministries and your medical care. So past abortion can really impact mental health. SMART, a group that essentially SMART stands for Science Matters in Abortion-Related Trauma. It's really a collection of the studies that do show poor mental health outcomes as a result of abortion. There's also a book called Complications if you're interested in digging more into that. Of course, it's not the case for every woman, but so many women are experiencing this and didn't realize they would experience this and haven't heard about this and are just in a lot of pain and need a lot of care. So there are 4 steps to referral that Support After Abortion recommends, and you can actually buy this, buy little cards that are referring to their website and also that remind you of these steps as a training resource. So the first is just to examine your judgment. You also want to ask if they want to share. You want to be considerate of their preferences. You want to walk in compassion, and you want to connect them to professional support. So you might have a stereotype in your mind, just like this picture, that it's a college girl having the abortion, but really, you don't know until you ask a woman's specific situation or story. So we do want to just be aware of any sorts of biases or stereotypes that we're coming in with, just to be able to encounter the person before us. So this is an amazing comparison guide from supportafterabortion.com. It lists all kinds of different curriculums, retreats, and studies, everything from videos to full weekends away to facilitated support groups or books. There's all sorts of different kinds of abortion healing. And you can start with secular programs, religious programs, mixed gender, just women, just men. It's really very inspiring, this comparison. So I highly recommend taking a look and seeing what sorts of programs you'd like to refer to or even bring in-house. Finally, the Institute of Reproductive Loss is about to come out with a new reproductive grief screening tool. I highly recommend you consider registering for their virtual symposium coming up in March. It's important when you're interacting with a client to really ask and listen and learn. In my interview with Dr. John Berchowski for this presentation, he often said that if a woman is looking down or avoiding eye contact, it could be that she's actually hiding the fact that she had an abortion. She might even be saying she had a miscarriage, but it may really have been an abortion. The baby was already alive at the time of the procedure, still alive. So you can't force them to disclose something like this. You have to be ready for them to tell you. It's an open invitation, and you can give them opportunities. And again, it goes back to listening. When you're having spiritual conversations with women, which really comes up in all these areas, whether it's prenatal diagnosis, adoption, reproductive loss, it might be helpful to actually have a spiritual chapel or prayer space, as I'm sure many of you do. You can also screen for church attendance on your intake form, which can open up conversations with women. And if you're going to pray with patients, there's a lot of different styles, and it's okay if they say no. But if you ask if they can pray with them, Dr. Berchowski said one thing that really helps him is just asking, can I pray for my wisdom with you right now? Because I need help to be able to care for your medical needs. And so that really is disarming, it's humbling, and it shows that God, Christ, is really the great physician. And even if she's not fully ready to pray, you could say something to try to attune to her, like, in my culture, there's a body, soul, and spirit. Have you been in touch with meditation? And are you aware that you're not a higher power? There is a higher power. You can have these sorts of conversations as it feels appropriate with patients. I wrote an article in Citygate Networks magazine. Citygate has a lot of gospel rescue missions, addiction recovery programs, homelessness ministries, and they too are really looking at how they can respond in a post-ops world and care for pregnant and parenting women and families. And so these are just a few suggestions, some of which I've talked about here, like partnering with your local pregnancy center and learning more about the abortion issue. But I do recommend reading the article just to understand a little bit more about attracting and accommodating pregnant women, customizing programs, looking for gaps in your community that can be filled, and editing your intake forms. And finally, this is just a selection of some of the organizations that I consulted or that I think would be helpful to you as you're on this journey of discerning a fully integrative approach in helping pregnant and parenting patients. I'd love to take your questions. If you have any questions coming out of this virtual presentation, please don't hesitate to email me at cmullinsgooley@herplan.org. I'd love to hear from you or introduce you to other members of the Herplan community. And again, please do register for our directory at herplan.org. And if you're not in one of our target states, you can check out our church guide, which is nationwide, at herplan.org/community. Thank you so much for your time. I pray that God will bless you all and lead you into this new season of opportunity, and that you might be able to do just a bit more to help pregnant or parenting women in your communities. God bless you.